Hi, my name's Dr. Edward Duran, and I wanted to spend a few minutes talking about Essure. So Essure is a contraceptive device, and it was invented by a company in California called Conceptus. What happened is in 2013, Bayer, the large pharmaceutical company based in Germany, bought the product Essure and started marketing it. There are over 1 million people in the world and 750,000 women in the United States that have Essure as their form of contraception. It was originally presented to OBGYNs as a non-surgical permanent contraceptive, an alternative to a tubal ligation. And it was something that could be done in the office with no general anesthesia, and that those patients could literally go back to work that day or the next day without any significant downtime. And that the tube would actually scar to this device, which is 4 centimeters long. The important thing is to understand the components of the device. The device has a core, which is a PET fiber that's equivalent to polyester, along with stainless steel and titanium. It also has 40 centimeters of nickel coiled around the center core. That nickel, we know that 20% of women are hypersensitive or allergic to nickel. So this device is made of 55% nickel. And what we've seen over the years is that patients started to complain of skin rashes, headaches, heavy menstrual bleeding, pelvic pain, joint pain, chronic fatigue, bloating, headaches, tooth loss, hair loss, and they had no explanation for this. Many women thought that they were just getting older and that it's part of aging. The FDA had hearings in September of 2015, and I went to Washington, D.C. and presented a video of a minimally invasive approach to remove Essure from patients that are having problems. 80% of women that have Essure removed are actually having hysterectomies. And some of these women are in their 20s or 30s, which is really tragic that they're having hysterectomies at such a young age, which can often accelerate their path to menopause. So my approach is to do a laparoscopy and robotically core out the Essure device, which is scarred into the uterus and the fallopian tube, and then remove the fallopian tube and sew up the area of the uterus that had the device scarred in it. It's a simple outpatient surgery procedure. It takes about an hour and a half to perform. Patients go home the same day and usually recover within 5 to 7 days. Many patients notice improvements of their heavy bleeding, pelvic pain, headaches immediately after the surgery. Some patients, a minority, have second thoughts about having permanent contraception, and they actually would like to have their fertility restored. So in those patients, you can remove the Essure device similarly by coring it out of the uterus. At that point, what you do is you just cut the fallopian tube where the device ends, and you can reimplant the remaining healthy portion of the fallopian tube into the uterus, thus restoring their fertility. So that I performed this surgery on over 200 patients and have had all of them get better after the surgery, many of them immediately after the surgery. And fortunately, Bayer has voluntarily decided to stop providing the device to the market as of December 31st, 2018, based on poor product performance and low sales. Because of social media and because of the press focusing on this device, they've decided that they're not going to be able to sustain the device in the market. And although the FDA did not ban the device like it was banned in other parts of the world, at least it will no longer be available in the US or anywhere else after the end of 2018.